Good morning, everyone, and welcome to day 4 of Psychological Professions Week. So this session is entitled Psychological Practitioners, Communities of Practice, A Changing Landscape. So my name is Liz Kell, and I'm co-chair of the North West Psychological Professions Network, and I'm really honoured to be hosting this event today, and it's fantastic to see so many of you all here. So before I hand over to Elspeth Ward and Paul Thompson, I just want to go over some housekeeping and then the plan for the session. And then you'll hear from me again at the end as I support the Q&A session. Elspeth, could you move the slides on for me? Thank you. And can I? Yeah, thank you. So firstly, you've probably already noticed that today's session is being recorded. This is just so it can be available for others who haven't been able to attend today, and it's going to be shared on the PPN web pages from next week. I have posted it in the questions as well, but if you are using captions or subtitles, then to turn on live captions during the session, if you select captions/subtitles on, so the CC button in your video controls, that should work for you. Can we ask that you keep yourselves on mute throughout the session, especially because there's so many of you? It's really important that we can manage the noise levels for our presenters. You will see that the chat is muted, but we have enabled the Q&A function. So throughout the session, you can of course use reactions to engage, but please feel free to post questions in that Q&A. You can like someone else's question, so then it gets lifted up the priority list. And we've got time for a Q&A session at the end. So it's my job to be monitoring those questions throughout and to coordinate that at the end. So finally, there will of course be an evaluation survey, which we'll share at the end of the session. It is only short, but it really helps us to understand how you found this session and plan for future sessions. So we'd really appreciate you taking the time to fill that in for us. So what's going to happen today then? Elspeth, move the slide on for me. Thank you. So in a moment, I'm going to hand over to Elspeth from the Northwest and Paul from the Northeast, who are hosting this session today. And they're first going to set the scene a little bit around the vision for the psychological professions and the PPN and communities of practice within the regions. We're then going to hear some examples from different practitioner-based communities of practice from across all of the PPN regions. And we're also going to hear from one of our experts by experience who's going to be talking about the real value and importance of their voice in all of this work. After some closing statements from Elspeth and Paul, we're then going to have an opportunity for Q&A with our panel members. We are going to do our very best to stick to time for you all, so you may occasionally hear me pop up with a time warning because that's going to be my job. So without further ado, I'm going to hand over to Paul Thompson, and I hope you enjoy the session.
Thanks, Liz. Nice to see everybody here. I'm just going to really set the scene a little bit about the PPN's vision. I'm sure we've all seen this, so transforming lives and communities by extending and embedding psychological knowledge and practice across the whole of health and social care. And that goes for the practitioners as well. So by uniting, we're trying to tackle all of these inequalities that we see time and time again. And earlier this week, we've seen some fantastic work being done around equity, diversity, inclusion, including the PPN's EDI position statement and the patient and carer race equality framework. Unfortunately, I wasn't able to attend yesterday, but I've heard that it was a really great day from the people that went. We all know that the psychological professions have undergone huge transformations over the past decade, and the PPN is committed to supporting all of the psychological professions, and our session today focuses on our psychological practitioner family. Over the past few years, our practitioner family has grown and diversified, and we've become a driving force in efforts to put people first, and I really firmly believe that. We see practitioners working across many areas of healthcare, too many to mention here, whereby everyone can benefit from the invaluable work that they do in helping to really make all health and care psychological. I first started working as a PWP in 2011, and since then I've seen many changes, some fantastic, others not so fantastic, but lately it seems that practitioners are becoming more empowered to transform and innovate within their own roles. And this is thanks to the PPN, the BPS and the BABCP. All of the work that happens in the background that most of us are unaware of, and all of that is constantly empowering our practitioners. Part of that is helping our as well as helping our communities to thrive, this work is also helping our practitioners to thrive. And part of this is down to the practitioner communities of practice. These have been developed across all of the regions, and today we'll hear from all of the COPs and hear about some of the work that they've been doing and some of the important initiatives that are going on. And I'll hand over to Elspeth now. Next slide, please.
Thank you, Paul. Liz, I might get you to take over letting people into the lobby just while I do this next bit, if that's okay.
No problem.
In terms of background, and I am going to keep this brief because I know policy can be not the most interesting of subjects, but I do think it is important that we think about this in context. So just for those of you that don't know, the PPN's kind of core functions and main messages to inform, enable and influence across the psychological profession space. And as part of that, the makeup of that, there are 7 regions across England. So there's the East of England, London, Midlands, North Eastern Yorkshire, North West, South East and South West. Proud to say that we've linked in and spoken with all the regions, and it's my pleasure in a moment to introduce 5 different regions who are going to showcase their work today, plus the national bit from David and Sam, of course, as well. Over the course of the session that you'll see that these people are presenting a variety of communities of practice and forums, all with slightly different aims, but also a key kind of overlapping component of a supportive space, a voice to the psychological practitioners. Some are looking at kind of CPD elements, others look at specific local issues or career progression. So there's loads of different and exciting work going on. The communities of practice are really important to us because the landscape is changing. The psychological professions workforce plan laid out a really ambitious programme to sort of move things forwards. And in terms of the psychological professions, the aims are to grow. So expanding the psychological professions workforce, and it'll be the fastest and largest growing section of the NHS workforce over the coming years. So improve access to psychological healthcare, develop clear and establish sort of clear and development opportunities for the psychological professions, particularly relevant to our practitioner workforce as the roles being so new. It also talks about diversifying, attracting and retaining people of talent from all backgrounds to better represent the populations that we serve. It also talks about leadership, and Paul touched on that in terms of us helping move that conversation on ourselves, leading. Each individual person can lead into that system and feed up into the regional and national picture as well, and transforming and embracing new ways of working, which as practitioners we absolutely do. And as I've said, we feel that the psychological practitioners have key roles to play in this plan, and we hope through the communities of practice and the PPN we're able to give those people a voice and give value and influence to that voice as well. Over the course of today, you'll hear about uniting, supporting each other and collaboration, and therefore it gives me great pleasure to introduce our first speaker this morning, who is Marie.
Thanks, Elspeth. So I'm Marie Boardman. I'm co-chair currently of the Senior PWP Forum in the West Midlands. Now, we've probably one of the longest standing forums for PWPs nationally. I'm aware the North East have also had a long standing one, but we were set up initially in 2018 with some colleagues because we didn't have a voice, we didn't have peer support, and there were challenges, as there always are with step 2 work, and we wanted to sort of share learning. We envisaged initially having face-to-face, so we booked rooms, had a central location in Birmingham, and with the intention to provide our senior PWPs a supportive forum, and to enable us all to understand and address our local and the regional topics that were linking into the national talking therapists team and relating to our roles as seniors and managing our workforce. To help us all identify key challenges in recruitment and retention of step 2 staff, and realise that we're not working in a silo, and a lot of us are experiencing the same issues within our services. We also wanted to highlight the work ongoing nationally and regionally, and present positive practice and learn from things. We spent a lot of time considering incorporating resilience and wellbeing into the roles and how we could support our teams. Sharing ideas and learning, again, you know, we don't want to be reinventing the wheel. There's lots of good practice and we need to learn and share and develop our teams. We also wanted to begin contributing to research at step 2, and to start to identify training needs. So we're very much aware that senior PWPs often progress into the role with no real leadership training available, but also looking at CPD opportunities for the seniors. As I said, we share best practice along local services, and we do encourage services to showcase what they're doing in service in there, and we do link up with the national IACT talking therapies KPIs as well. And we also noticed that from the beginning we really started to notice a real change in services. So services were going away from the meetings and looking at initiatives, looking and developing wellbeing, self-care ideas, developing new roles within the services. Next slide please, Elspeth. So that was how we began on our vision, but it was all about information and sharing. But then COVID came along and we really had to change our pace. So it was initially changed to once a month for a peer catch-up support, because we were all in a changing environment and, you know, things were changing almost hourly at some points during COVID. So just to keep us focused and supported, and particularly through that very challenging time. We fed back and linked in monthly with the local clinical network, and through that link we were able to really push the needs of the step 2 workforce around CPDs. I'm sure people remember there was lots of CPD events available in the early days of COVID for step 3, but very little for step 2. So I like to think that our voice in that monthly clinical network actually brought about thinking about our step 2 workforce. During that time we also expanded and included Midlands wide, so it included the East Midlands and Shropshire, because we'd converted into a Teams meeting, so which grew the group. Now we are approximately every 6 weeks, and we do a 1.5 hour meeting, which I think is much more available for seniors and leads, and actually reduces the impact on services as well, because having a full day out regularly can be quite impactful for services. We invite guest speakers, often invited by interest led by the group who want to learn more about specific things, so preceptorship, career development, all that sort of thing. But we also allow peer support and reflective space, because we're very conscious step 2 work still remains quite intensive and quite challenging. There's also been quite a significant change in the format of the group, in as much as there are a lot more senior PWPs across the network, but also the roles have grown and developed. So we've got leads and coordinators and specialists. So what we're currently doing is liaising with the group how they want to move forward, you know, and do we consider now opening up to be more of a COP and inviting more of the step 2 groups, so they can learn and develop from what we've learned over the last 5 years. So it's an ever-changing landscape. We learn and grow and transform. It's all around information sharing and supporting one another. So thanks, Elspeth.
Thank you, Marie. And I'm just going to move on to Simon now.
Thank you, Elspeth. So I'm Simon Winter. I'm currently co-chair of the PPN PWP subnetwork in the southeast with Lizzie Gray. I work in West Sussex and Lizzie is in East Sussex, and we also both co-chair the national PWP Leeds network, which has been going for nearly 2 years now. So a bit of context about our subnetwork. Lizzie and I were the two people that sort of came forward when the PPN had its first conference, which I believe was in 2019 at the Gatwick Hilton. They were sort of putting out feelers for subnetworks for any of the psychological professions to get started, and we showed an interest, and it sort of grew from there. And we had a really nice launch event a few months later in West Sussex, and a lot of support from the PPN. So we had people like Adrian Whittington attending and giving a lot of support, and a sort of keynote speech from Paul Ferrand from Exeter University. And that in those days we were limited to the 3 southeast counties of Kent, Surrey and Sussex. That's now broadened out when the PPN changed to the southeast. We now include, I think I'm right in saying it's 8 counties in the southeast, and this did represent a bit of a challenge for us, but we have welcomed some new members, and it's a growing task to reach out to all those services in the different counties. We've always been motivated to really put the PWP profession at the forefront of thinking, certainly within the PPN and elsewhere. We've been able to engage very well with the PPN through their board meetings or workforce council meetings, which we attend, to put our point of view across and to give our opinions on changes in the profession, and I think that's really important. And we've always felt very welcome to do that. And I think things like the curriculum changes that came in last year have been there's been a lot of participation from networks like our own, so that's been a real positive. And so yeah, fostering positive change and career progression is really important, and we're seeing that now with the creation of the Band 7 roles and even some Band 8A roles at Step 2 at low intensity. Our committee's always been open to lead PWPs, seniors and PWPs, and we've always had some representation from our course providers as well, from particularly Surrey University and Reading University. Next slide, please. So we feel that our subnetwork enables PWPs to see beyond the hierarchy of talking therapies, giving people permission to ask questions and understand how things can be different and better. We have generally monthly meetings where we come together as a group and compare best practice, for example, and see how we can take things forward, what we can take back to the PPN board. We feel that the subnetwork provides a real structure and hopefully some role models demonstrating, as I say, what best practice can look like. And we hope that it unites PWPs within specific champion roles, and this is something where it's a bit new for us, but we're currently rolling out a program of monthly events starting on the 30th of November with an LGBTQ champion event, which we hope is going to kind of unite champions across the Southeast and get them talking to each other. And this, of course, as we grow, can include champions or people with an interest in these different areas who aren't PWPs, who are in some of the other practitioner roles. And last slide, please. So we're soon going to change to being called a community of practice, and we do hope to welcome these other practitioner roles across the Southeast. And the PPN has been very proactive in creating a new Wellbeing Practitioner Leadership Fellowship from next January, which is a 6-month secondment. And one of their tasks is the establishment of this community of practice. And that's a real positive. I think that's really going to help move this forward, because we all do these PPN roles in our spare time, and it'd be really nice to have someone focusing on that and being able to put more time into that. So that's the future. It's going to be interesting, with such a large area, to bring all these people together and to see how we can integrate the different practitioner roles. And obviously, not everything we do can be standardized. We're working with adults, and some of the new practitioners are working with children, but I'm sure we'll find a lot of commonality as well, and both be able to get the support of the PPN. Thank you.
Thank you so much, Simon. So Emma and Zach.
Hi, everyone. It's so great to be here today. I'm Zach Glaser. I am co-chair of the London Community of Practice for PWPs alongside Emma Lockhart. It's great to be here. Just to get everybody up, we're probably one of the newer communities of practice within the PPN. We've only been up and running for about 6 months now, in which we've currently developed a marketing via social media and other platforms to raise awareness and to gain membership for our community of practice. We've been hosting regular community meetings to hear from PWPs across London and across the actual professions, so not just qualified PWPs, trainee PWPs, assistant PWPs, as well as senior PWPs and other lead PWPs. We have developed a link liaison with the London education provider UCL, which has been really good. They've been helped to promote our community of practice and to raise awareness across other services of our existence as well. And we've also been attending Psychological Professions Network London Council meetings to support discussions about IAP developments and EDI issues, and then feeding those back to NHS England as well. We've also been promoting the development of new Step 2 roles across London. For example, Band 4 assistant PWP roles. We've really been advocating for this role because it's helping to increase access into our specific particular practitioner role for maybe people that don't have a mental health background but are interested in changing career fields. And so this provides them with the years of clinical experience doing triages and working with in other capacities within an IAP setting so that they can get onto PWP training. We've also been promoting the development of community engagement PWP roles across London as well. And this is to help increase access across various communities, especially where there seems to be a disparity in access. Our community engagement PWPs would work with various community-based organizations, faith organizations, as well as medical organizations across London to promote our services, but also to promote our services across the populations in the various boroughs. We're also happy to promote the development of the Band 7 lead PWP roles here in London as well. It's nice to see that this role has been implemented in various boroughs and services across London. But we're also promoting the development of the Band 8A professional lead PWP role as well. We've seen that pop up in one or two of the boroughs, and I'm happy to say that in my particular service, this is now a new role that's been implemented as well. So a lot's going on with the development of the PWP role and increasing access to the PWP role, but also increasing the ability to stay within the role as a PWP by developing new pathways for advancement. So it's great. It's great to see that this is being rolled out. As a PWP myself, I'm very happy to be a part of this change. But I'll hand it off now to Emma.
Thanks, Zach. If we can move to the next slide. Thank you. So hi everyone, my name is Emma Lockhart. I'm the PWP professional lead for Hammersmith and Fulham and the co-chair with Zach for the London Community of Practice PWPs. We are looking to expand hopefully to moving towards including other low intensity workforce practitioners. So if you are a practitioner, step 2 practitioner in education or children and young persons services and you work in London, please reach out. We'd love to hear from you to think about increasing our community to support you as well. Moving forwards, we're wanting to develop a quarterly meeting with the Step 2 service lead. So we've got a lot of support and advocacy from the PWPs kind of on the ground doing the job. But I think what we're noticing is there's lots of barriers that we're facing in kind of working with services to deliver changes and think about the PWP role perhaps in a slightly different, more value-driven way. So we're hoping to develop a quarterly meeting where we're meeting with the Step 2 service lead so we can all work together to kind of drive the vision forwards for PWPs or low intensity practitioners. We're hoping to create links with NHS England in a more kind of specific way, as well as services to improve the value of the PWP role. And as Zach was kind of hinting there, developing it as a profession in its own right, potentially a core profession one day. We're wanting to really work with PWPs to build their voice within their local services to drive change. So what this might mean is considering some kind of leadership or management or change management training for PWPs as part of the community of practice to help them understand and work within the systems that we have to influence locally within their services and to really empower them to be confident with the skills that they all bring to the table. And we all know that we have lots of skills, but perhaps they aren't always highlighted or put into practice in the roles. We're also looking to develop a CPD for London services to really improve the quality of the clinical work that's provided to clients. We're aware that CPD currently, particularly in London, but I expect also nationally, is very much dependent on the service and the trust that you work with, maybe what their budgets are and the access that you have. But we're aware obviously the PWP curriculum changes might mean that people don't have access to CPD that is helpful for them in increasing and developing their toolkit. So we're hoping to develop some CPD to really kind of influence services and PWPs to develop skills in that way. Thank you.
Thanks, Emma. That's great. I'm just going to move the slide along and it'll come to the northwest. And I think Kirsty, Chloe and Scharine are going to help us with this bit.
Thanks, Elspeth. I'm just going to quickly introduce us. So my name is Kirsty McNeilis and I'm one of the co-chairs of the Psychological Practitioner Community of Practice in the Northwest. I'm a children and young persons wellbeing practitioner by background and currently teach on the CYWP and also Education Mental Health Practitioner or EMHP course in the Northwest. And along with Elspeth and Chloe Booth and Scharine Mebarkia, we make up the co-chairs of our Community of Practice. So I think Chloe's going to tell us a little bit first about how that developed.
Thanks, Kirsty. Hi, everyone. I'm Chloe Booth. I'm one of the co-chairs of the Northwest PPN and also a CYWP by background. So I'm going to tell you a little bit about our Kickstarter Community of Practice event that took place last December. So this is really what started our Community of Practice in the Northwest. During this event, the members that attended spent some time in small groups thinking about what they'd like from a community of practice and what that might look like to them. And we made sure that all of the groups that were together were sort of mixed of the different psychological practitioners so that we could all network and share each other's ideas. So after that, we collated all the information and we were able to sort of identify some reoccurring themes of what people might want that community of practice to look like. So a lot of the members fed back to us that they would like a space to share resources and also to encourage best practice as well. A space for networking was a really common theme that came up. So a space that could be either in person through regular quarterly meetups and events such as the Kickstarter event, as well as a virtual space as well to network. Another really popular theme that came up as well from the members was an opportunity for representation and a national voice for our low intensity workforce. So for things to be taken back from the members higher up to sort of facilitate change. And one of the other reoccurring themes was as well, we might be the only one, a psychological practitioner that's in our service, and that can feel quite isolating at times. So a space to network, meet other psychological practitioners, and to create a space that people can use for those sort of reoccurring themes. So I'm going to hand over back to Kirsty now, just to think about the opportunities and gains that we identified from having a community of practice in the Northwest. Thank you.
Thanks, Chloe. Yeah, I think I guess just personally speaking, as somebody from the children and young persons wellbeing practitioner background, I think one of the really exciting opportunities about the Kickstarter event, which took kind of the established PWP community of practice in the Northwest and expanded that to include these other roles, was just to have that opportunity to have kind of bigger support to learn from what had been already tried and tested and done well with the PWP workforce, and for us to learn about each other's roles. I think we do have these quite established different psychological practitioner roles developing across the Northwest, and to get us all together and connect. I think sometimes after training courses finish and you might be, as Chloe said, the only one in your service, there's a risk of feeling a bit disconnected, and having that peer support was one of the kind of the opportunities that this united community of practice presented for us, as well as kind of giving us that bigger voice, bigger community, louder voice, as it says on there. I think particularly for some of the more newly established roles, having that kind of backing of other low intensity trained psychological practitioners to help kind of push that message forward of championing these roles. I know it was mentioned as well when Marie spoke earlier, this idea of kind of the community of practice being a really good way of trying to reduce duplication of work or silo working, and giving that oversight of what's happening across the region, particularly when services are quite spread out and quite geographically kind of distant from one another. Having a way of just checking in on what others are doing was one of the kind of the gains that we felt would come from bringing us all together in one community of practice. And then the little quote on the bottom of the slide there is actually something that came up just in our conversation when the four co-chairs were talking about what it was we wanted to kind of talk about today and what we wanted to share about our community of practice. We just kind of, I think, felt that sometimes the term low intensity gets a little bit of a bad rep maybe, and that actually we want to really have kind of a community of us across the Northwest championing this idea that actually it's the right intensity for what a lot of people need, and it can be a really powerful and helpful and life-changing intervention for a lot of people, and that we wanted to kind of, make that part of our message today. So I'm going to pass on to Scharine now, who's going to kind of cover our second slide and talk a little bit about where we're up to with our community of practice so far.
Thank you, Kirsty. So my name is Scharine Mebarkia, and I'm a mental health and wellbeing practitioner for Greater Manchester Mental Health. So what have we done so far, and what does the Northwest PPM look like? So we did a Kickstarter event in December 2022, which is one of the first events I personally attended. And it was really helpful to be in a room full of other psychological practitioners and really sit around the table and really understand the differences between the roles. So in order to make sure that we're all equally represented, we kind of adapted to a co-chair model. So there's 4 practitioners appointed to represent all 4 roles. So obviously you've got our lovely names on the screen, and we're all here. We have regular co-chair meetings just to catch up, see how things are, make any plans for any kind of more events that we want to do, or how to publicise things. And they go ahead kind of really quite frequently. We developed a terms of reference, so we kind of break down what we mean by certain terms and make sure that it is kind of easily understandable. We have a lovely revamped website, which is kind of really user-friendly. I kind of signpost a lot of mental health wellbeing practitioners to that website, and even students and stuff that I come across, because it is kind of the career map and understanding what it looks like, how do we get there, what are the next steps. That can be really helpful for someone kind of wanting to step into these roles. We've launched a quarterly newsletter to give an update of us from kind of the chair's perspective and also from a PPN's perspective of things that are going to happen. And we also have created an Instagram and LinkedIn page to kind of get into the social media side. It's slowly coming, but we are there. We've done a few posts, and always helps to kind of reach out with the audience, because times have changed. It's not just kind of Twitter or X, whatever it is now. It's kind of Instagram and LinkedIn, and really using those kind of networking sites to our advantage. Also offering in-person and online events, because I love an in-person event. It can be difficult to kind of find a location and availability and things like that. So we also kind of see the value of online events like this, because we can always just find a room, jump on, doesn't have to take half a day travelling. And taps, I think I'm passing back to Elspeth for taps.
I was going to say, I think I said I'd cover it, didn't I, Scharine? So it is, the Northwest is my area, so it's the place that I've worked as a PWP, and now obviously doing a slightly different role, but thinking about the development of the roles is really important to me. And I suppose the reason I was picking up the taps is some of you may or may not be aware of the trainee associate psychological practitioner role that is currently being piloted in the Northwest. And there was an event in PP Week on Monday afternoon, which has been recorded if any of you want to catch up on that and a bit more information about that role. However, the reason it's relevant to us here is it's another role that is kind of in that low intensity sort of remit and forum. And in terms of the terms of reference and reviewing our membership, we are kind of constantly thinking and having those conversations within our region about kind of who should be in our community of practice and keeping that conversation going. So I suppose that's what we just wanted to reference there as well. So that is us in the Northwest. And I am now passing over to Dr. Sarah Fishburn to cover the Northeast and Yorkshire, please, Sarah.
Thank you. So my name's Sarah, and I'm the Secretary of the Northeast and Yorkshire Community of Practice. So I do have a background in PWP working, so over 10 years ago, and also a senior lecturer on the PWP training programme at Teesside University. So our community of practice is still relatively new. So we were wanting to get established in the summer of last year and held our first meeting in December of last year. So still very much finding our feet, and would echo the previous speakers about saying, you know, developing those terms of reference, etc. So a lot of work has gone into that. We now have over 50 members and have made efforts to ensure that all practitioners are involved where possible in the community of practice. So PWPs, CWPs, EMHPs and MHWPs, which was a mouthful to get my mouth around there, but hopefully got all of those terms correct. And one of the overarching aims for our community of practice is to provide an inspirational space and act as a catalyst for practitioner-focused projects and development. And what we hope to do with the community practice is inspire across the whole practitioner career journey. So with that, kind of aspiring practitioners and inspiring aspiring practitioners, I'm not sure about other people's journey, but I think that when I was first looking to go into psychological professions, there wasn't a lot of good information out there about what those career pathways might look like. So we have been trying to work with schools and colleges and undergraduate programs to ensure that people know about those different roles and what those roles will involve, and inspire interest in the roles and really help people to apply for roles in an informed way. And also as part of that, developing a mentorship program to help aspiring practitioners to enter into the roles that they want, as opposed to just applying for anything that's available and thinking about things and these careers as a bit of a stepping stone. They are roles within themselves, as was mentioned, and hopefully that will have a positive impact on the practitioner culture. We know that retention and recruitment sometimes can be challenging within these roles, and we would really hope to inspire people to stay in these roles for as long as possible because they have so much value. with our current practitioners and inspiring current practitioners, by working with those who want to be in the role, we can hopefully inspire dedication and commitment to those practitioner roles. There's huge value in those roles, and we work very closely with people in services and in practitioner focused roles to help hopefully inspire new roles and pathways and developments for psychological practitioners. And I think by doing that, this can prevent roles from potentially becoming a little bit stale or stagnant, and really enhance the skill sets of psychological practitioners. I know a few people have mentioned kind of that focus on CPD, which I think is so important for that lifelong learning, and hopefully will help to retain people within the workforce and keep that passion for the role going. So there's a lot of work with current psychological practitioners, leads and seniors to inspire practitioners to develop their own research and get involved with projects, special interest projects that might interest them, that will contribute to the workforce, but also help potentially with their own career progression as well into other roles. And thinking about practitioners moving on, by working with people coming into and working within psychological practitioner roles, we hope to support those who are leaving the role to do so when they're ready, and inspire a change in the culture. So we need to get better at supporting psychological practitioners in their role so that they don't move on when they're feeling burnt out, and before they were quite naturally ready to leave. If we can hopefully inspire a bit of a culture change, then hopefully we'll be able to retain staff for as long as humanly possible within these roles. So we want to inspire an expectation that practitioners will stay in their role rather than the expectation that they will leave. And if practitioners feel listened to, invested in, supported, and have a space to feel inspired, hopefully they'll be more likely to stay within their roles. However, we do realise that for some people, psychological practitioner roles are not the final destination, and potentially we need to get better at acknowledging that and supporting people to make the very best of their role, gain value from it, and work with practitioners on an individual level to create a meaningful path forward for them in terms of their career development. So we would like psychological practitioners to move on from roles with a clear career path rather than that scattergun approach to applying for roles, because it's assumed that people naturally get to a point where they do move on very quickly. So regardless of the stage of career, we really want to inspire psychological practitioners to get involved with the PPN, with the communities of practice, and with each other. And that's me.
Fab, thanks, Sarah. So we're going to have a bit of a change of, oh no, we're not. We are going to have a bit of a change of pace, not the change of pace that I was about to say we're going to do our EB bit with, but we're going to talk about the low intensity special interest group first with Sam and David.
Morning, everybody. Don't make me heart stop by saying we're going to have a change of pace. So hello, everybody. My name's David Rayson, and I am co-chair of the BABCP Low Intensity SIG. My background is I'm a senior PWP, and I'm also Step 2 clinical lead in alternative talking therapies, a co-chair of the North East Senior PWP Forum, and soon to be a part-time lecturer at Teesside Uni with Paul and Sarah. And I'll let my other co-chair introduce herself.
Hi everyone, my name is Sam Torney. I am a PWP by background, and I am also a team lead over at Shropshire, Telford and Wrekin Talking Therapies, and as David said, the co-chair of the BABCP Special Interest Group for Low Intensity Work.
So we're here today to sort of talk about the low intensity SIG. Currently, we have approximately nearly 1,300 members of the low intensity SIG. And alongside us, we have a committee right across the low intensity practitioner roles. We are very conscious that we're heavily PWP centric, but we do have a CWP on the committee as well. And I guess what we want to point out this morning is going through a manifesto that the committee has pulled together for the SIG members, which were presented for the first time at our first open meeting last Friday. So I guess this sets out what our aspirations are as a SIG. First of all, we want to assist with producing a programme of CPD which is accessible and of interest to all wellbeing practitioner roles, whilst not overlapping with any other training also on offer. We're very keen in this SIG to reach out to all the low intensity practitioner roles, and that's right across the country. I mean, we can speak for the BABCP, but as you can see from the slide, other organisations are available for people to register with. So what we're hoping to do is kind of make this SIG really of interest right across the breadth of roles and across the country as well. Sam?
So the second thing that we're really keen on being involved in is to support wellbeing practitioners becoming more involved with research. We've been working with people in the BABCP to look at this, look at how low intensity workers can be forefront of doing the research for low intensity, but also trying to provide people with information of how they can get involved, how they can start writing, where are the basics with research, where do you begin? And that's something we're quite excited that's coming forward in the next few months for people.
I guess the other thing that we want to do within the SIG is why we're here today as well, to work in partnership with the PPNs and also the senior PWP forums, both locally and nationally, where areas of interest overlap. So it's more reaching out and connecting to all these other sort of forums and organisations now, where I've worked in talking therapies for over 11 years now, and I can't remember a time where everything seems to be connecting up the way it is now. So the SIG's really keen to be part of that as well.
And then on the back of that as well, we've got a real clear focus on communication. The BABCP went from, I think, having very few members that were wellbeing practitioners to, since registration, having over 3,000 now in the various different wellbeing practitioner roles. So our idea is to provide regular newsletters, regular updates of what's going on in the world of wellbeing practitioner and low intensity work, having open meetings, like David said, we had one last Friday, and then being able to feed back to SIG members from some of the stuff they're bringing to us. We're not able to be a union, we keep saying, that's not what we're here for. We're just here to be a bit of a voice for people. So if there are issues, there are concerns that keep being raised, we can look at that and then we can feed back into the general population.
I think what the SIG also can provide is we recognise that the PWPs have been through the registration process, and other low intensity roles are currently going through that registration process with the BABCP, and any kind of help or ways we can liaise with the BABCP around the registration and re-registration process, and any kind of hiccups or bumps in the road that happen with that. We've already fed some of those things back, which is a useful line of communication. And I guess people that are registering, it's demonstrating that they are being listened to, and we take things forward when we possibly can for them.
And then finally, mostly what we're keen to do is to protect and support the interests and wellbeing of people in wellbeing practitioner roles. For those of us that have been PWPs for quite a while, we've seen things develop and things move on, and difficulties over the last decade or so of getting a voice for PWPs. And then we're now watching the same thing happen for the newer roles. And so we really want to be here for all the roles to make sure we're focusing on development, making sure we are looking at retention, that people want to stay in these roles, that there are career development within it, and also clear guidelines for appropriate workloads. So it's not like we're having to do things differently, always different across the country, across all the different parts of the British Isles as well, that we all know what we're doing, we're all working in the same way. And that's really important to us to make sure people have got support with that.
And just to kind of finish up, if anybody wants to become a member, Of the SIG, you have to be a member of the BABCP. That's all we can speak for, because unfortunately we don't have anybody here from the BPS. But it's relatively simple to join just through the BABCP website.
Thanks, David, and thanks, Sam. Really lovely to have you and to speak about the low intensity SIG today. So I'm going to take us on, hopefully, there we go, to a slightly different flavour now, I suppose, and talk a little bit about kind of expert by experience involvement. And really fortunate in the Northwest to have the PPN Northwest Expert by Experience Steering Group. And they've done loads and loads of work over the last couple of years in terms of thinking about meaningful engagement of experts by experience. And I think for me, when we were kind of looking at the community of practice, it was really important to consider how that might fit in there as well. But I just wanted to direct you to two things. We were going to show the animation, but I want to make sure we leave time for questions. So I want to direct you to the Expert by Experience animation and discussion toolkit, which are available on the Psychological Professions Network Northwest website. And I would really encourage you to look at those, because it talks and speaks really powerfully about kind of how EBE can be involved, and both within services and within kind of your clinical work, but also kind of how it might fit into other areas of kind of things as well. So would absolutely direct you to have a look at those after this session. But what I do want to do is play a conversation that Ali and myself recorded that speaks this. So hopefully you will be able to hear it okay, fingers crossed. Okay, so hi Ali. So firstly, what I wanted to do was thank you for your involvement both today but also in the development of the session. It's been really rewarding to work with you in a co-produced way, and really proud to be part of the Northwest Expert by Experience Steering Group, and to have you here and involved with the session that we're running. Liz, has that frozen for you?
It has, yes. I suspect it's buffering.
Yes, that's what I fear too. Bear with me 1 second. Let me just check the internet connection on this computer. How is it for you being involved today?
Well, I have to say thank you, Elspeth. You know, it's been really an amazing journey with you in co-producing, or being part of co-production with this session, and it's really also really ticked a really big box for me, because part of our EBE evaluation really underscored how much all of us want to work more cross-regionally for the multiple benefits of working cross-regionally, which I guess is one of the ways that kind of threads into communities of practice, because it's that shared learning that we can do across the seven regions is so important. So it's been amazing to be part of this. Thank you, Elspeth.
Right. So I suppose one of the questions that I had when I first started my role here, but also in previous roles that I've held, and perhaps for some of our audience members who are here today, with the pressures of service targets or perhaps vacancies that teams will hold, leading to staffing issues, people might feel challenged as to how they can involve experts by experience, or where they might fit, or why we should be making it a priority. So I was wondering if you could tell me a little bit about kind of why EBE involvement is important and the value that it brings.
I guess, you know, I suppose, you know, we've screened the EBE animation, so that speaks very powerfully to what really is the benefit of EBE involvement, and that's my voice obviously is part of that animation, but it's the voice of others, but it's also the voice of everyone in our PPN EBE steering group jointly that speaks so powerfully to really what is embedded within the long-term plan. It's embedded within the psychological professions vision for England. How do we ensure that all services, all workforce, everyone within planning and strategy benefit from the knowledge that an expert by experience of their lived experience of mental health, and obviously that crossover into physical health and general health, that they can bring to the table to shape services, shape training, multiple benefits that really come from having that joint experience together.
Thank you. And I suppose thinking more specifically about communities of practice and the newer psychological practitioner roles specifically, in what ways can you imagine EBEs being involved in this space? And I suppose in sort of addition to that, how can we ensure that that engagement really is meaningful rather than sort of just a token gesture?
I think that really thinking about communities of practice, and it's what's been spoken about so powerfully through the sessions today, is how you take that shared learning in a space, whatever modality that community of practice is representing, how you take that shared learning and make it group learning. So it's kind of it's the individual, it's the group, and you carry that forward. And so I guess my identity, your identity, our identity, it's fused with the shared identity of all in a community of practice. So whether you're an expert by qualification, an expert by profession, or an expert by experience, we share common goals and the desire to use our knowledge to improve practice, to share best practice, to inform collectively to benefit the group and services going forward. What can an EBE add? An EBE in learning together and reflecting together, it really adds richness and texture to having maybe a different knowledge. I mean, and obviously there is always going to be lived experience in the space, but having that EBE perspective really to shape learning and have the different conversations that wouldn't have happened without that EBE voice within the space. So the community of practice is enhanced and it's aligned to the goals of the long-term plan to ensure the lived experience voice is woven through, every part of the National Health Service England as we go forward together. And I guess that it's a key part of the psychological professions vision for England. That one of the key points that was underscored was across all psychological professions, leadership activity to enable meaningful EB experience involvement to shape the best outcomes. And really that was that was for thinking, I suppose, more towards how the public benefits, but this is also how communities of practice can benefit by EB involvement.
Yeah, thank you. And hopefully this, albeit very short conversation today, gives people something to take away, something to think about how they might be able to kind of consider this within their own workplaces or regions as they go forward today. So thank you very much. It's been an absolute pleasure to have you involved with co-production right through. And I suppose that is the thing that I wanted to note, is that you've been involved with the planning of this session as well as kind of the involvement today. So kind of thinking about that journey right through the process for expert by experience involvement as well. So thank you very much, Ali. It's much appreciated.
Thank you, Elspeth.
And I'm just going to now hand over to Paul to pull together some of what we've spoken about over the course of the session.
Thanks, Elspeth. Thanks again, everybody, for all the time and effort you've put into today. It's really great to hear all of the fantastic work that's been done across the whole country. And I guess one of the key things from this experience for me is that we're all starting to work together. We're not working in silos anymore. We're communicating and we're getting better at it week by week and day by day. So just before we come on to the Q&A section, I'd like to take a moment to reflect on what you've heard and learned from the PPN week so far. Are you feeling united, inspired and enabled? Can you go away from this week being empowered to inform, influence and transform? Thinking about the things you've watched or participated in. Is this helping with your approach to your work, to the practitioner role in general? Because for me, you're already doing all of these things because you change lives, you change your colleagues' lives, you change lives of those around you, and most importantly, you change your patients' lives. You might be the one good thing in somebody's day, so please don't ever forget that. You are inspiring, you are enabled, and you can influence. So on that note, this is your call to action. We invite you to join the PPN, we invite you to join your communities of practice, to help share your good practice, to learn from each other, and most importantly, to unite us and to work together to transform lives and communities by extending and embedding psychological knowledge and practice across the whole of health and social care. And on that note, I will hand back to Liz, who's going to coordinate our questions and answer session.
Thank you so much, Paul, and thank you everyone. What a fantastic session. It's so good to hear all the incredible work that's been going on. I've been busily tweeting about you all as we've been going, so do go and I don't know how you say Xing, it just sounds wrong, so I'm sticking with tweeting. But yeah, thank you all so much. Elspeth, do we want to stop sharing the slides and have some faces on the screen for the Q&A?
I am glad you said that because it means I can see you all too.
There's not been a huge number of questions yet, so do keep them coming in, but I've got a few that I would like to put to people. So the first question, and Emma, I think it came up while you were talking, so I'm going to put it to you to start off with, is just really about, there was a question about how a lead PWP is different from a senior PWP and in what way. So would you mind taking that, Emma?
Sure, great question. I think what we're finding is this might vary nationally, and it's a piece of work that actually we're looking at in the lead PWP national network around senior PWP role. Certainly in London, generally the differences would be, I guess, the level of responsibility and oversight that a lead PWP might have over the team. The lead PWP might line manage or supervise senior PWPs or more experienced qualified PWPs. They would be involved as part of the senior leadership around strategy for the PWP workforce within the team, looking at increasing value, bit of jargon, but increasing quality. So they might look at the kind of the clinical skills that's provided, the supervision that's provided, what's happening during treatment sessions, building in CPD. And in London, certainly in my trust, they would work very, very closely with the professional lead for PWPs in kind of delivering that day to day. Hopefully that answers your question.
Yeah, thank you, Emma. And I think for me, one of the things that's been really lovely is as the different roles have developed from, you know, having band 6 senior PWPs and then often lead roles are at higher bands, it also gives that voice and representation at those kind of wider management and strategic meetings. And it's so important that that representation comes from within the workforce. So it's a fantastic development as far as I'm concerned. There was also a question which I did give a little bit of answer to in the chat, but Scharine, around the involvement of MHWPs in COPs as one of the newer psychological practitioner roles. So I know you talked about that a little bit when we were talking about the Northwest, and a lot of the regions mentioned that, but I didn't know if you wanted to say anything to that, Scharine.
Yes, so I think it as one of the newer roles, I think it was really kind of important for the mental health and wellbeing practitioners and trainees to get involved in the PPN, just because it can give you that reassurance that PWPs have been through it like 10 years. I remember when I went to the meeting in November, I remember specifically Elspeth saying, like, I did this like 10-15 years ago, and that just really inspired much more confidence because I was in one of the first cohorts, so we were kind of just rolling with it. So having that support, speaking to other roles, linking in with other mental health and wellbeing practitioners across the country, I think it can really help boost your confidence and again instill that kind of passion and hope that it is working and it is progressing and getting better.
Thanks, Scharine. We also had a question about how we get more men into these roles, which is a very good point. We know that there's not always been as much diversity in the workforce as we would like. I don't want to pick on the men in the panel, but it kind of feels right that we ask Paul or Simon or David or Zach to speak to that to start off.
I'd be happy to come in there. I think it's a great question. I'm currently lucky to be running a QI project in my service on engaging men in our service much better, because we know nationally 31% of referrals to talking therapies are male, and we know the suicide rate is something like 75% male, so there's big discrepancies there, and that's reflected in the workforce, isn't it? I have one male PWP in my team of 25 or so. Actually, no, I have two. But yeah, it's always been like that. I think the apprenticeships may be helping that. I think we've seen as that's opened out to people from different backgrounds, and also encourage people later in life as well to come in to talking therapies. I think that's helping. But it starts at the bottom, doesn't it? We know that people still tell when they're going through their psychology degrees and they have their careers talks, talking therapies is not really on the agenda. I know someone who's on clinical psychology training with 90 people, and most of them don't have a good attitude about CBT, and they're not told about talking therapies as an option. So I think there's a lot of work to be done there, and that might also encourage more men to come into it. So yeah, I think the more, yeah, absolutely, the more male patients we see, the more that will have a knock-on effect, I think, because we find quite a lot that the PWPs that we do recruit have their own lived experience of talking therapies, and so if we've got a lot of male patients having that experience, then maybe that will help as well.
Absolutely, thank you, Simon. And I think also with the new curriculum, there's the update to have a part-time option for people to work in the role part-time as a trainee, and I think that's also really going to help services think about the diversity of people who come into the roles, which is really important. So we've just had a question come through, which I'm kind of going to throw open to any of you really, is about how we encourage services to recognise the amazing work that psychological practitioners do and encourage services to embed them inside their models and services. I don't even know how to pick on a person to answer that question. But does anybody want to give a thought or a view? Kirsty.
I guess kind of a small way, but it's all about the small steps, isn't it? Building up to the whole. But one of the things that we've done in the Northwest is, as we've now developed our psychological practitioner community practice newsletter, we've made sure that that's shared with all the services across the Northwest as well, and part of what we're hoping to draw into that is some examples of best practice and all the amazing work that psychological practitioners do. So I guess that's a slight chink in the wall maybe of getting that message out there of look what amazing things we can do, and making sure that the right people at the top of the services are getting that sent out to them as well.
Yeah, thank you, Kirsty. And I guess because as we talk about these community of practice sitting within or attached to the wider psychological professions networks, that also means that it raises profiles in a different way and enables that kind of recognition in a different way, which I think is so important. Oh, everybody's going now. David.
Yeah, I was just going to say, I mean, within our service, we're currently the service manager, we're having a step 2 advertising promotion. So I think it's very much the service recognises the work that low intensity does. It also recognises the longer waiting lists and how it's Chinese whispers that it has an effect on referrals because we have long waits, but we don't have long waits at step 2. So I think the service is really proactive in pushing that out there. And I think other organisations are really surprised at the variety of work that low intensity does and how quick that can be accessed in the different modalities. So I think it's really positive that, you know, we're getting out there and we're advertising our wares across the North Tyneside patch.
Absolutely. Thanks, David. Marie?
Yeah, from my point of view, being the chair, one of the chairs of the Senior PWP Forum, he's actually been present at the monthly clinical network meetings and actually having a voice with all the service leads and commissioners and links into the national team for the PWPs, because those meetings historically were very much CBT based. And by having a step 2 voice in there has really opened up the value of the workforce.
Thank you, Marie. Paul?
I was going to say exactly the same thing. So I sit on the Workforce Council for the North Eastern Yorkshire, and it's about being there and having those discussions at a systemic level. So that can also filter down as well as working from the ground up almost, you will. So eventually we'll meet in the middle, hopefully. But yeah, just being present and having that voice and pushing the practitioner manifesto of almost.
Thanks, Paul. And Scharine?
Echoing it again, but yeah, following the last question about mental health and wellbeing practitioners, that's also a really key thing, just to feedback how we've got on with the course, how we're finding it in practice, and knowing that our feedback is going somewhere. I think it's invaluable, especially in the newer roles.
Absolutely. Thanks, Scharine. So we've had a question from Alan. Sorry, I'm naming you, but so he said, it's really encouraging to hear so much about low intensity CBT workforce engaging in research. In the panel's opinion, which areas of low intensity CBT would benefit most from an increase in related research? And he's also said, I also think it's time for new names to feature on low intensity CBT publications. There are some, but could be more. And he'd already put a plug earlier on for those who didn't see it, that the BABCP Low Intensity Day and the BABCP conference in July 2024 will have a focus on low intensity research and publications. So does anybody want to take that? So I think the question is, in the panel's opinion, which area of low intensity CBT would benefit most from an increase in related research? Kirsty?
I'm jumping in quickly to wave the flag for children and young people. I think a lot of the research that is used on the courses to kind of underpin kind of what we do with children and young people in a low intensity way is drawn from adult research. And I think the pool is widening, but yeah, I'd like to see much more research in these interventions with children and young people.
Thanks, Kirsty. Paul?
I think all of it, to be honest. I think it's about time practitioners did research for practitioners, and the research that's out there already is fantastic and it's good, but a lot of it's outdated as well. So the role has changed so much over the past, how long is it now, 15 years since we were created as a PWP. We need to try and update the evidence base from practitioners rather than for them.
Thanks, Paul. Simon?
Yeah, really good point, Paul. I'd like to see some solid research into the modalities of treatment that we offer at low intensity, because services will work very differently. And I think, you know, running, for example, a program of psycho-educational webinars against guided self-help, against outsourced digital options, shall we say, I think all needs testing out. We don't have enough data on the effectiveness of those different modalities, so that would be one thing.
Thanks, Simon. Sarah?
Well, I think a lot of my points have been taken up by Paul and Simon, but I will throw in some additionals as well. I think a lot about kind of the effectiveness, like specifically of low intensity interventions, you know. So I think when often people are coming and we're drawing upon the literature about the specific interventions that low intensity practitioners do and how effective they are. A lot of the kind of the research out there is either outdated or a lot of the time based upon high intensity literature or trials that have been done over 16 sessions, which is not how low intensity practitioners work as well. So I think kind of really representing kind of the low intensity conditions and how that works and getting good evidence base out there is really important.
Yeah, absolutely. And I think probably in the different settings as well as the different roles have developed, that a lot of the evidence is in specific settings. So there's a bit of a gap there in the research right now, I think. David?
I think just to echo everything that everybody said, but we're all aware right across the curriculums and the roles that there are various things that low intensity practitioners are told they can't work with. So if the evidence base isn't there, research is going to provide a different evidence base. So I think it's really important that research is taken forward by low intensity practitioners about the work that they do to inform kind of everything really. So yeah, just echo what everybody else says.
Absolutely. That's such an important point, David, because PWPs and the newer practitioner roles have always been really firmly cemented in the evidence base, haven't they? But that evidence base has to keep growing to enable the innovation with the roles as well. So yeah, fantastic point. Okay, thank you. So had a couple of questions from TAPS in the audience. So and it's lovely to have you here. And obviously Elspeth mentioned that we are in the process in the Northwest where the TAPS role has started of thinking about how TAPS can be represented within that community of practice. But we've also had a question from Bethany, who said, I'm a TAP, I'm very interested in the flexibility of roles that sit within this forum. As the TAP role is pioneering in the Northwest, how can we further embed ourselves within the PPN so we can continue to be involved with a voice, avoiding the challenges the initial PWP role came up against? Elspeth, would you like to take that?
Thanks. I think the main thing for me is registering with the PPN. That's kind of the way to get in terms of being involved with kind of the work that is going on. As somebody else alluded to on the panel as part of their presentation, the PPN is voluntary for most of it. You know, it is something that we do because we are passionate. So if you are passionate about your role, I would absolutely encourage you to come along. Liz and Geeta as co-chairs, or myself, I'm sure would be happy to be contacted if you're struggling with that in the Northwest. But if you go to the main PPN website, it directs you to your own local region if you're not with us. So I would certainly say registering, getting involved, thinking about the community of practice development that we're on with in the Northwest for including the TAPS, because it is about having that voice and having, you know, those spaces and opportunities and forums that we can then tap into as part of the PPN. I hope that sort of answers it, Liz.
Thank you, Elspeth. Can I be really cheeky and ask a question? I really loved, Sarah, what you said about inspiring practitioners to stay in the role, but also a meaningful pathway to progress into other roles when it's the right time to do so. And I'm just wondering what role you think the community of practice can have in supporting people who do progress into other roles to still be allies and supporters of practitioners throughout their progression through the psychological professions and still be really championing the value of what we do.
I think it's a really interesting point. It's a really good point. I mean, from being kind of in the low intensity world and especially kind of as an educator, we often see now that people are going out of kind of practitioner roles at an earlier rate than, you know, kind of a decade ago. And I understand, obviously, you're in a cost of living crisis, and you know there's reasons why people want to kind of progress quite quickly. But I think people really understanding the value of these roles will, even if people decide naturally, where do my skill sets lie? I'm after a bit more of a challenge. Like they're attending the community of practice, they're understanding a lot more about their specific skill sets and where that vision goes. We would hope that they can also be champions in when they move on to other roles, to inspire people to enter these professions and be able to kind of still be a voice as to how important they are and the value of these roles. And I can see there's 2 other hands up as well, so they probably want to jump in.
Thank you, Sarah. Elspeth?
Yeah, I think I wouldn't disagree with anything you've said, Sarah. I think I've been sat in a lot of meetings recently, and particular psychological professional groups are more represented in some of those higher meetings because we are representing new roles. We haven't necessarily, I know it was lovely to hear Zach and Emma talk about some of the progression in London and the posts available through the more traditional structure now for some of those roles. But I think whilst that is still a process of development and learning for a lot of areas and regions, it's really important to know who your colleagues and friends are within some of the rest of the wider psychological family, so that those people, you can have those conversations more locally and make sure that they are aware of all the roles and kind of what they can bring, I suppose is what I wanted to add. Paul?
Thanks. For me, it's about taking a step back. We get focused on the people leaving the role and the people moving on. But actually, if we take a step back in more of a longitudinal approach, to be honest, we need to look at people coming into the role as well as the people in the role. So if for instance, in the Northeast, we've been working with Anyone, which is a kind of business company that engage with schools. So we've gone through with them into doing talks with schools and getting people interested in the roles so they know exactly what they're coming into, rather than this scattergun approach of just going for whatever they can get. So once we get that part right, and we get the people coming into the roles who want to be in the roles and are taking value from the roles, then when they leave the roles, more of a chance to be a champion for the role. I think it's a more longitudinal approach. I don't think it's a quick fix at all.
Yeah, thank you, Paul. Yeah, and you know, obviously I was involved in community practice as they were being set up right at the start for what was then just psychological wellbeing practitioners, and it's fantastic to hear today about how they have grown and all the amazing work that happens in the community practice. So if you're not already involved in your regions, please do join them. Emma?
Thank you. So I just wanted to add a little bit to that conversation. I think we have to tackle it at all different points of entry and exit in the role. And I think for me, something that I've noticed across my career, I've been a PWP for almost 10 years now, is there's a very systemic sort of question, which I get asked, even with this role, when you're going to do the high intensity training. So I think there's a lot around, we need to work with services to reduce that narrative, because what that might mean or might say to PWPs is that your role isn't as valuable. Let's look at this next shiny step, which if that's your career aspirations, then great. But for some people, it might not be. And actually, there are ways in which they can develop within the PWP role and really embrace the skills that they have. So I think a lot of it is also working with people in the teams and the support systems they have, which often are the kind of more clinical leadership roles, to try and shift that narrative and think about the way. It might not be we're not valuing it, but maybe what we're saying might say to people that actually it's not as valuable as other clinical roles. So I think it's tackling it across the board, which is, I know, a huge piece of work. We're all trying to do it from the work we're doing. But I think there's a lot in that, and that's something that I've experienced a lot in my career.
Yeah. Thank you, Emma. And I think that's so important. And it's lovely to have people in the room today who are here because they've chosen to value being in a practitioner role and find ways to develop within that. And, you know, I'm proud to have done that myself. I've been a low intensity practitioner for, it'll be 20 years in January since I started my training. It's a very long time. And yeah, I've had lots of, when you're doing your high intensity training, why haven't you? And I've chosen to stay with that practitioner role because I value it. And yes, I've moved on and progressed in different ways, and really proud to be the first co-chair of a PPM region who is from a practitioner background. So, you know, the more people stay in these roles and grow and develop, the more examples of that we will see. Thanks, Emma. I think that's really important. Simon. Oh, no, sorry, Sarah first. I got my numbers wrong. I'm trying to stick to order.
I was just really going to echo kind of what Emma said, that there almost seems to be that culture where as soon as you get to the 2-year post-qualification mark, that there's instant questions now about when are you going to go on to high intensity. And I guess that is a systemic kind of issue, as mentioned, but for a lot of people who we train, where they have real value in that practitioner role, I think sometimes they look around and they hear those questions and they're like, oh, well, I need to do this because all of my colleagues are talking about this. And there can almost be that kind of like comparison of where should I be in terms of my career, kind of alongside peers who they might have trained with as well. So I think being incredibly passionate and advocating that this is a role unto itself and how much you can get from those roles and all of the progression opportunities that are coming up through lead roles, I think is just so important.
Thanks, Sarah. Simon.
Yeah, I think times are changing. You know, for years and years, our service had 1 or 2 senior PWPs, and then suddenly with the expansion, you know, my part of it has 6 senior PWPs. So there's more progression there, but we have to recognise that's still a band 6 role. You get in, you qualify as a CBT therapist, and you're on band 7, and it also still gives you more opportunity to progress beyond that. You know, it's great that there are roles like Emma's professional lead role, which are few and far between still, but you know, I think in 10 years' time, maybe we'll be looking back and thinking, well, isn't it great that PWP is now this profession in its own right, and it's got its own structure feeding into the senior management teams in services. So let's hope it goes in that direction.
Thank you, Simon. And Marie, I'll come to you for the last comment.
Yeah, so from my perspective, having been involved in clinical education on the apprenticeship programme, that's actually starting to open additional doors to encourage a diverse workforce. I was actually at a careers event for psychological professions, and I was just really proud and shouting out the value of being a PWP, and not necessarily, even though lots of other places are looking at clinical doctorate and other professions in psychological work, I was there representing the step 2 workforce, and I think that's the start of how things will grow. Like Simon said, over the coming years now, we're getting our foot in and really growing as a professional workforce.
Thanks, Marie. Very well said. So we are coming up to 11 o'clock, so I am going to draw us to a close. I have just posted the evaluation form, which is a Microsoft Forms link, into the chat. So if people could take the time to fill that in, we would really appreciate it. I want to really thank all of our speakers. If I say all of your names, we will go over time, so I'm not going to do that. But thank you all so much for your contributions, and a special thanks to Elspeth and to Paul for coordinating today, and to Ali for her fantastic input as an expert by experience. We really value and appreciate having you here today. So thank you so much to everyone. As with all good practitioner sessions, I'm very proud that we have managed our time so effectively and packed in so much content, because that's what we do. It's been really lovely to see you all today and to have you all here and involved. And I hope you enjoy the rest of Psychological Professions Week and any other sessions you go to. Thank you again for your engagement and your time.